I'm Suzanne Andriukaitis. I'm the Executive Director of NAMI of Greater Chicago. NAMI stands for the National Alliance on Mental Illness. I've been the Executive Director here for 15 years. I am actually a licensed clinical social worker, and prior to coming to NAMI, I worked in an inpatient psychiatric facility for 20 years. But I'm here to talk about healthcare reform, and it is something that we have needed for a very long time. There are, at this point in time, my understanding is 47 million or more Americans who are totally uninsured, and that is a group of individuals that are posing a problem, that have a problem that is not only their own personal problem, but it is a problem that has an impact on all of us. For example, when one goes to the emergency room for care, either for yourself or a family member for emergency type care, you'll find that there are lots and lots of individuals there looking for regular, ordinary medical care that if they had insurance they would be able to find in a doctor's office and wouldn't be there taking up the time of the emergency room staff. And you can see it in the staffs and the people who work in emergency rooms that they're fatigued these days because they have so many individuals that they're dealing with all day long that when people really do need emergency care because they're bleeding or because they're having a heart attack or whatever kind of a critical emergency, it really is hard for the emergency room staff to address that. And many people have commented that the fact is that everyone who is insured is also, and everyone who's a taxpayer is also paying for the care that people receive in the emergency rooms. If people had insurance, many of those individuals who are there in the emergency rooms would have gone to see a doctor earlier. Whatever problem they're presenting in the emergency room would have been taken care of when it was a smaller problem and a less costly problem to deal with. So the reality is that having so many people, such a large percentage of our population uninsured, is really proving to be a huge financial burden for all of us.